Opinions, options, answers. Voice America Health and Wellness.
Welcome to Psychiatry, Ask the Expert, hosted by Dr. Neil Kaye. All comments, views, and opinions expressed are solely those of the host, guests, and callers. Dr. Kaye will not diagnose or treat callers. The information provided is informational in nature. In the next hour, Dr. Kaye explores the inner workings of the brain and mind. Grab a pen and paper and sit back. Here is your host, Dr. Neil Kaye.
Good evening, everyone, and welcome to Psychiatry Ask the Expert. I'm Dr. Neil Kaye, and my co-host Jay Birch and I want to welcome you all to our show tonight.
Hi, Neil. How are you doing this evening?
Great, Jay.
Show number 11, you know.
It is. We're having a great time, going fast. Each week on Psychiatry Ask the Expert, we focus on a specific topic in psychiatry. We talk about the disease or illness itself, the common symptoms and presentation of the illness, and, of course, treatment options with a focus on psychopharmacology, the medication treatments. We talk about potential risks and benefits, side effects, dosing, and when and how to use the best medications. Tonight, we are very honored to have a friend and colleague, Dr. Robin Sesan, with us. Dr. Sesan is founder and director of the Brandywine Center in Wilmington, Delaware. Her group focuses on women's issues, including recovery from eating disorders, self-esteem, self-care, body image issues, sexuality, and interpersonal relationships. Tonight, we'll be discussing eating disorders, including anorexia and bulimia. Welcome, Dr. Sesan.
Hi, Neil. Hi, Jay. Glad to be here.
Robin, glad to have you here this evening.
Good to see you. We're going to have a good night tonight for sure. Tonight, listeners can call in with questions and comments at any time. Call-in number 866-472-5792.
Neil, we're going to start this evening with our radar segment. Anything hitting your screen recently?
I've got three things tonight, Jay, two very relevant to our topic with our guest tonight. First, new study on anorexia nervosa, which frequently has been talked about as a response to fashion models, Western culture, and the need to be slim, now seems to have a better understood genetic component coming out of the Swedish twin study cohort that exists. They are now saying that there's about a 56% contribution to the development of anorexia from the genetic side of the equation, that there's a greater need to study the genes more. It may run in families more. Parents should not necessarily blame themselves so much for the problem because they may be actually passing on genes and not necessarily modeling improperly. Second one, another bulimia study, another kind of eating disorder we'll be talking about tonight. This one's suggesting that there's a relationship between attention deficit hyperactivity disorder, ADHD, and bulimia in some women, and that may lead to some future medications and developments. Last one is kind of a concerning one regarding a drug known as Abilify or aripiprazole. It's actually the newest antipsychotic on the market, and it's being used dramatically off-label, meaning for people who are not psychotic. This is particularly in children. The new study is suggesting that this antipsychotic is now the most commonly prescribed psychiatric medication in minors. And while I have always taken a position that off-label use of medications is appropriate when there's an evidence base to suggest that there just really isn't the evidence base to support the widespread use of the drug that is now being reported, and I'm somewhat concerned and alarmed. I think patients and families and doctors need to be a little bit more sober about this kind of robust early off-label use of a medication that really has not been studied well in that area. Jay, what's on your radar screen this week?
You know, it's interesting. I guess we can prove that based on our radar screens this week, great minds don't necessarily run in the same circles, because my radar screen was barraged by articles totally unrelated to tonight's topics, but definitely related to our overall topic of mental health. I've got one, my first one, from the February 22nd issue of the Wall Street Journal. The article itself was entitled Military Families Battle Physical Mental Issues, and the reason why this caught my attention was this is an article written by a family practitioner out in Illinois, and he's writing about essentially an outbreak of physical and mental illnesses among his patients, his patient population, which happens to be the family and dependents of servicemen over in Iraq and serving in the war. And while we discussed post-traumatic stress disorder in one of our shows, we really talked about the victims or the people actually experiencing the trauma, and what we really should not fail to emphasize, and this article really hits home on that concept, is the fact that there are families and there are people out there who are undergoing a very stressful life based on the jobs and the career choices of people in their families, families of police officers, firemen, certainly servicemen, physicians as well. And these people are prone to a greater incidence of physical and mental maladies just because of the stress related to the job choice of one of their loved ones. Does this kind of make sense to you?
It makes absolute sense, Jay. I'm glad you actually mentioned the police and firemen, rescue workers. Big issue, and a lot of them often feel that they're supposed to be strong, not show any of the emotional response, and end up turning to drugs or alcohol or taking it out on family. And so it is a big factor. It certainly does influence them, and they should not be forgotten. So absolutely, I agree with that. I think it's very consistent with what we see out in the trenches and what our literature shows. What else you have?
My second one, I'll just touch on this quickly because it seems to be an evolving story. But in today's Wall Street Journal, in their health column, was an article entitled "Curing Teen Night Owls, Doctors Probe Why It's Hard for Many Kids to Get Up." And essentially this is what the article says. It's postulating that there are many kids out there who are being either misdiagnosed or mistakenly diagnosed somehow with attention deficit disorder or even depression or some type of behavioral problem, when in fact what they really have is delayed sleep phase syndrome, which seems to be a process whereby the body's clock has somehow stuck in a fast-forward position. And these kids are actually physically incapable of falling asleep until very late at night or very, very early in the morning. As you know, you're a teenager, you've got to get up then early in the morning and go to school and be in top performance shape. What happens is these kids get to school, they fall asleep, they get labeled as having attention deficit disorder or not paying attention or having some kind of learning disability. Fortunately, there is a therapy called chronotherapy, and essentially involves not pharmacology, but resetting the body's clock. Key message here is, if your child is experiencing this or you notice this about your child, don't be limited in thinking that it must be attention deficit disorder or it must be depression or it must be a behavioral problem. Think about the possibility of one of these newfound sleep disorders, and maybe that's it. Seek out a sleep medicine expert.
Good idea, Jay, and I think it points out a couple of things. Again, overdiagnosis of ADD or misdiagnosis of ADD by people who aren't really doing complete evaluations, and that's an ongoing problem in medicine. In 2 weeks from now, actually, we're going to have Dr. John Townsend with us, a sleep disorder specialist, and we'll be talking more about sleep disorders, but it is a real problem. America is a sleep-deprived country. I want to make sure we get to questions with Dr. Sesan and get right into it with Robin, so let me shift us into the illness side of the equation. Robin, can you talk to us and our audience about the common terms and words we hear in the world of eating disorder, anorexia, bulimia? Tell us all about it.
Okay. Anorexia is what we really describe as the disorder of self-starvation, and this is when people basically starve themselves. It often starts as a diet, a restrictive diet, and people stop eating breakfast, they stop eating lunch, and they might eat a dinner meal. And gradually over time, they reduce their intake so much so that they begin to drastically lose weight and show some very, very significant signs of starvation. Of the eating disorders, it's probably the one that's the most lethal and the most serious. Bulimia is the disorder that we talk about in terms of the binge-purge syndrome. So these are people who are eating usually large quantities of food at a given time until they are so full that they either fall asleep, they're incredibly physically distressed, and then they get rid of the food in some way. Most commonly, people vomit, throw up, make themselves do that. But we also have a variant of bulimia where people compensate by compulsively exercising. So someone will eat 5,000 calories in a binge, will spend the next day at the gym doing 4, 5, 6 hours of intense cardio to burn off those calories.
You mentioned self-starvation, which I find very interesting. I've also heard anorexia talked about as a disorder of body image. Can you talk about the difference between body image or how that actually fits into these diagnoses, if it still does?
It absolutely does, and it's very, very complicated. And let me talk a little bit about starvation, because the effects of starvation are biological effects that often lead to cognitive distortions. So when someone's body weight gets below a certain level, they stop thinking rationally and they stop seeing things clearly. So when someone who's anorexic looks at themselves in the mirror, they see a very, very distorted image. And they really see that image. They see themselves as much larger than they are. And it's a complicated biological, social issue. Now, body image in general is something that many women and increasingly boys and men struggle with in our culture. It's almost become normative for women to dislike their bodies and to view their bodies in a distorted way. So it's a very, very difficult thing to flesh out. But what I really want to emphasize is that the effects of starvation are physiological effects, and for a long time we just thought that people with anorexia were resistant or were obviously lying. And in fact, what we're seeing is that there's a very strong correlation between the effects of starvation and these symptoms.
Before we go to break, just tell us quickly, if you can, how common are these disorders? What percentage of the population are we looking at?
These disorders are increasingly common. What we see is about 1 in 4, 1 in 6 college students struggle with some kind of an eating disorder. It may not be a diagnosable eating disorder. It may be a subclinical eating disorder, but the numbers are really quite high. We see more evidence of bulimia and binge eating than we do of anorexia. But anorexia, I would estimate that about 1 in 100 college students are struggling with it.
Okay, 1 out of 100. That's actually a pretty big number. We're going to go to break and come back and be talking with Dr. Robin Sesan on eating disorders. You're on Psychiatry Ask the Expert.
Real Life Solutions. Voice America Health and Wellness.
To perform at your maximum potential, you need to have all aspects of your life working properly. On Mind, Brain, and Body, Dr. Michael John Kell will bring you honest, open discussions concerning your physical, mental, and financial health. If you're ready to find purpose and meaning in your life, tune in to Mind, Brain, and Body every Friday at 8 a.m. Pacific. Mind, Brain, and Body on Voice America Health and Wellness. Radio dedicated to your health, wealth, wisdom, and purpose.
Videos de aprendizaje de inglés. Máxima calidad.
Nunca escucharás a alguien vendiendo educación en la calle, pero con programas familiares gratuitos sí puedes obtener la educación que necesitas. Llame al 1-877-326-5481 para información sobre programas gratuitos de educación familiar.
Mira, vengan aquí. Obtengo un mejor vocabulario en inglés garantizado.
El primer paso a una vida mejor. Un mensaje del National Center for Family Literacy y el Ad Council.
Achieve exceptional levels of health and fitness through integrating the very best in fitness, nutrition, and healing. Tune into Total Fitness with fitness, nutrition, and healing coaches Catherine Carrion and James Williams. Each week, get inspired to exercise, eat and rest in harmony with your body's needs, and take advantage of effective natural healing methods with in-depth cutting-edge information and advice. Get fit, get healthy, get motivated, and get real with Total Fitness, broadcasting every Friday at 7 a.m. on Voice America Health and Wellness.
Are you tired of being tired? Are you sick of sitting around while life passes you by? You can get back on track by tuning in to Voice America Health and Wellness every Monday at 12 p.m. Pacific Time for Attracting Abundance, the Energy of Success with Carol Look. Attracting Abundance is the program that empowers you to finally break through your limiting beliefs and blocks and shows you how to succeed in all areas of your life, from improved financial abundance, health and weight problems, as well as your relationships. Don't wait another week to be joyful. Listen to Attracting Abundance, the Energy of Success with Carol Look this Monday at 12 p.m. Pacific Time right here on Voice America Health and Wellness.
Parents, did you know that high school dropouts make 42% less than graduates? Someone will have to make up that difference, and chances are that will be you. That means paying 42% of their groceries.
Ooh, more candy.
42% of their dentist bills.
No more candy.
Even 42% of their therapy sessions.
It's all my dad's fault.
Save your money. Encourage your kids to stay in school. For help and advice, call 877-FORAKID. A message from the U.S. Army and the Ad Council.
A fresh look at today's health. Voice America Health and Wellness.
Welcome back to Psychiatry Ask the Expert. If you have a question or comment, dial toll-free at 1-866-369-3742. Now back to the show. Here's Dr. K.
Welcome back to Psychiatry Ask the Expert. Actually, tonight we're using 866-472-5792 for our call-in number. So callers, give us a call anytime. We're talking about eating disorders with Dr. Sesan.
Robin, right before we went to the break, we talked about how common these eating disorders were, and you mentioned 1 in 4, perhaps 1 in 6 college students. Now, by college students, you're talking about females and males, or just females? Can you be a little bit more specific?
Okay, that's a great question. And what we are looking at is that for every 10 women on a college campus who struggle with an eating disorder, there's 1 man.
Oh, okay.
So the disorders are still much more common and much more prevalent in women.
And is that regardless of the disorder? It's 10 to 1,
yes,
females to males?
That is regardless of the disorder. It's very, very hard, though, to get a handle on what's happening with young men and body image, because we see certainly a lot of men becoming very preoccupied with weightlifting and weight training and building their bodies in certain ways. And I really think in some ways it's a variant of a body image disorder.
These disorders, are they usually presenting during that college-age time period? Is that why you're referencing these college-age kids?
Well, one of the reasons I'm referencing the college-age kids is because they're the easiest group to study.
Oh,
so they're the group that we have the most information on. But what we used to find, say, 15 years ago, was what I would call a bimodal distribution of the onset of eating disorders. So we would often see the onset somewhere around 14 to 16, and then we would see another onset 18 to 21. We're still seeing some of that, but we're actually seeing eating disorders earlier. So I see and get calls from parents who are concerned about 9-year-olds and 10-year-olds. So we're seeing the age go down in terms of the onset of the eating disorder.
And if one gets to be 30, have you pretty much cleared the hurdle as far as an eating disorder is concerned?
Again, very interesting question, because there is new research looking at the increased incidence of eating disorders for women at midlife. Now, some of these women had been eating disordered in their teens and 20s and moved into a pretty solid recovery. But as they approach midlife, 40s, 50s, are relapsing very significantly back into an eating disorder. There are other women who have not had eating disorders, but again, as they move into midlife, are developing anorexia and bulimia. So this is a new phenomenon that we're starting to look at.
In the younger onset cases, what role does sports play? I know I was a wrestler in high school, and the guys were always dieting, binging, purging, laxatives, doing all of these things to make weight for the team. We have girls in ballet, dancing, gymnastics, other sports, again, where there's an advantage to being lighter, thinner, or whatever. Is that somehow promoting these disorders?
Well, I'm not sure that it's promoting the disorder, but these sports, these arts, are putting girls and boys at increased risk, which really gets into the whole issue about why, how do eating disorders develop. Because if you have a child who in some way has a predisposition to developing an eating disorder and they end up in wrestling or they end up in ballet or ice skating or gymnastics, these are the other high-risk sports, if they come in with a predisposition, whether that's a personality predisposition, whether it's a family predisposition, whether it's a genetic predisposition, those sports are likely, due to the pressure and emphasis on thinness or weighing within a certain range, to kick someone into some eating disordered behaviors.
This use of the word predisposition and, of course, Neil's article on his radar screen about the influence of genetics, just then take us to what are the causes that we know of eating disorders?
Well, for a long time we've talked about eating disorders as having causes based in family systems, causes based in one's personality structure, causes based in sociocultural environment, and now we're looking at the genetic issue. So, for example, children who are very, very perfectionistic, children who have a need for high control in their lives, are going to have personality characteristics that might predispose them to develop an eating disorder. But other things have to be right. Like, they have to be living in a culture that values thinness, for example. They have to be seeing those images around. They might also come from a family that places a strong emphasis on appearance and achievement. So we need to have certain things in place to activate the predisposition.
But those things, all of those things beyond the genetics, seem to be relatively easily identifiable sources or contributors to eating disorders. Mm-hmm. So, and I don't want to get ahead of myself here, but are these things that once you meet a patient, you can say, well, I can understand how this happened because you were in this environment?
Sure. When I work with a patient and I start flushing out the family history, some of the personality issues, some of their life experiences, some of how much they've bought into the cultural ideal of beauty, I can start putting together a picture as to how this person, compared to the person sitting next to her, developed the eating disorder. Because we used to blame the culture. We used to say, well, look at all the images out there. Of course, everyone's going to be eating disordered. But the reality is everyone is exposed to those images. The question becomes, why does one girl develop the eating disorder and the girl sitting next to her in 11th grade doesn't?
You talk about the images, and I've always been fascinated by this whole image issue from a sexist perspective. So my disclaimer is up there. But if you look at what I'll call men's magazines, pornography, Playboy, things like that, what you're seeing are women who are not anorexic at all. They may have thin waist, but they've got body parts. They've got curves all over the place. Raquel Welch has been the idol for a man for 30, 40 years in this country.
You're dating yourself.
I am, without a doubt. But they're curvaceous, whereas if you pick up a copy of a women's fashion magazine, you see Twiggy. You see these thin waifs, and it seems that women buy the magazines with the pictures of the thin women, and men buy the magazines with the pictures of rounder women. What's that all about?
Well, I would actually have to disagree with you.
Okay, that's great. We'll disagree.
Because there have actually been studies that have looked at Playboy centerfolds over the last 25 to 30 years. And what they have found with the Playboy centerfolds is that the women have gotten increasingly thinner and increasingly smaller. Now, what's happening is that those women have incredibly unnatural thin waists and very large breasts.
So we're at the Barbie doll image made with silicone.
Exactly.
Okay.
And that's what's happening, is that the Playboy centerfolds are being surgically altered.
Oh, I like getting that one cleared off for myself and the audience. Now, you used the word recovery earlier, and I found that very interesting, because I usually hear the word recovery and I think about addiction, and I also think about lifelong problem. Does that factor into what we're talking about tonight?
Well, in some ways it does. I mean, the addiction issue is a very, very controversial one, and I personally don't really look at eating disorders as an addiction. They certainly have elements that are very, very similar in terms of cravings and in terms of compulsive behavior, in terms of self-soothing, using the food as a way of soothing. But in terms of recovery, I do believe that recovering from an eating disorder is a lifelong process, very, very similar to going into an alcohol or drug recovery, that it's a one-day-at-a-time process.
So basically we're not using the word cure when we're talking about eating disorders.
I don't use the word cure, although I do have to say that the majority of people that I have treated over the last 25 years have stopped being symptomatic.
Okay, so you get good outcome, but you don't fool yourself that you could be cured.
Right. Like, for example, cure for someone with very severe anorexia is getting to a point where they can eat 3 meals a day, 2 snacks, maintain a weight that's within a healthy weight for them. But the majority of people who have struggled with anorexia for 5 years, 10 years, do not move into a category that I would call normal eater. They continue to eat in a very structured, somewhat restrictive way, but have learned to not be so afraid of food.
So maybe they still have some of the body image issues, but they're normal weight now.
Exactly.
Okay. So can somebody, because those are two separate concepts, can someone have normal body weight and still have an eating disorder?
Absolutely. Body weight, that's right. Body weight is just one small factor with an eating disorder. Now, in order to be diagnosed as anorexic, you really need to be 15% below what your normal body weight would be. Typically, people who have bulimia are normal weight, maybe even a little bit overweight, and people with binge eating disorder sometimes are normal weight. More often than not, those are people who carry extra weight.
You've talked a little bit about kids, younger adults, adolescents, whatever. What should our parents look for? Parents of teens, parents of the tweens, this new generation that is increasingly being artificially turned into adults through media, dress, and culture and whatever. But what should everybody be looking for as warning signs?
Well, before we even get to the warning signs, I think that parents and families really need to model healthy body esteem, healthy body acceptance, tolerance of different shapes and sizes. So from the time you have a child, I think it's very, very important that these things be modeled and these things be talked about.
What are some things that a parent could do or shouldn't do?
Well, one of the things that I think is really important is to let your children know how wonderful their bodies are and what miraculous, wonderful things our bodies can do, like jump and walk and feel pleasure and feel pain and, to take it away from the focus on all our bodies are or appearance-related items. So that's one thing. I think parents also should not overly focus on teaching their children to be restrictive. They should not overly focus on children who sometimes want some sweets. They should not overly focus on appearance and body image issues.
Should parents make comments to their kids about their weight? I have parents who say, they call their kids fatty, or they're telling them what they should and shouldn't do in that regard.
No, I don't think parents should make comments about their children's weight unless their children come to them, or unless at a visit to the pediatrician notes some concern.
All right, we'll be back after the break with Dr. Sesan talking about eating disorders on Psychiatry. Ask the Expert.
Opinions, options, answers. Voice America Health and Wellness.
Stay mentally, physically, and emotionally fit with Younger Every Day. Hosted by Dr. Bob Payson. Broadcast every Friday at 10 a.m. Pacific Time, 1 p.m. Eastern Time on the Voice America Health and Wellness channel. Younger Every Day will offer you alternative solutions for a variety of health issues, all backed by clinical, scientific, and medical data. Dr. Payson and other expert guests will inform and inspire people of all ages to look and feel better. Younger Every Day. Think clearer, feel strong, grow younger. With Dr. Bob Payson, right here on Voice America Health and Wellness.
Women, do you feel that you're too old to be active, too old to be beautiful, too old to have fun, or too old to be fabulous? Well, if that's what you think, then there's good news for you. You're wrong. Tune in to Voice America every Wednesday at 8 a.m. Pacific Standard Time for Aging Outside the Box, Fabulous Women Over 50 with Shirley Mitchell. Aging Outside the Box is a fabulous, fun program that gives you every reason to feel greater than you ever have. Host Shirley Mitchell and OE Cruiser Small will cover phenomenal topics such as women's issues, health, diet, exercise, nutrition, faith, travel, and many other concerns for women of all ages. Feel young, feel smart, and feel fabulous by tuning in to Aging Outside the Box. Fabulous Women Over 50 with Shirley Mitchell every Wednesday at 8 a.m. Pacific Standard Time, right here on VoiceAmerica.com.
To perform at your maximum potential, you need to have all aspects of your life working properly. On Mind, Brain, and Body, Dr. Michael John Kell will bring you honest, open discussions concerning your physical, mental, and financial health. If you're ready to find purpose and meaning in your life, tune in to Mind, Brain, and Body every Friday at 8 a.m. Pacific. Mind, Brain, and Body on Voice America Health and Wellness. Radio dedicated to your health, wealth, wisdom, and purpose.
Step into a healthier you. Voice America Health and Wellness.
Welcome back to Psychiatry Ask the Expert. If you have a question or comment, dial toll-free at 1-866-369-3742. Now back to the show. Here's Dr. K.
Welcome back to Psychiatry Ask the Expert. Call-in number 866-472-5792. With Dr. Sesan. Now, Robin, before we went to break, we kind of cut you off in the middle of the do's and don'ts for parents. So let you finish the answer there.
Well, I think I actually finished the do's and don'ts, but the part of your question that I didn't answer, because I sidetracked us, was what should parents be on the lookout for? And I think that that's a really important question, because I really have had teenagers referred to me who, over a period of 6 months, had lost 25 pounds, and their parents hadn't noticed. The clothes the kids can wear, they can hide it. You know, what teenager lets their parents see them without clothes? That doesn't happen very often. So I think it's really important that parents be very attuned to what's going on with their kids in terms of their eating and their body image. And we live in a culture where many, many parents are both working. Teenagers are not in the home very much. They're out with their friends. They're out at school. A lot of times kids who develop anorexia are the model student. So they're involved in the after-school activities, and they're getting extra help, and they're volunteering. So I think parents really need to keep an eye on what are their children eating for breakfast. What are they eating at lunch? And, of course, they're not at lunch with them, so you might not be able to know. I think they need to look at what they're doing at dinner time. And teenagers can be very, very slippery in this area. You know, they say, well, I went out to lunch with my friends. I got a hamburger, french fries, and a shake. Well, how do you know whether that's true or not? So I think that the parents really have to know more about where their kids are, what they're doing, what they look like. Another sign is you take your daughter to buy jeans, and I have a 17-year-old. You take her to buy jeans, and she flips out because she's in a size 3, not a size 1. Well, I would get very concerned if my daughter had that reaction. Or she's been wearing size 7s, and you go, and the 1s are starting to fall off of her, and she's actually happy about that. So these are some signs that you need to look at. You need to look at the compulsive exercising. How often is she working out? How often is she running? How often is she doing yoga? Everyone thinks yoga is a great thing. Well, yoga can be a compulsive exercise the same way other things can be.
Robin, you're starting to use terms like compulsive and other things that have gotten away from a eating disorder kind of a concept. And where I'm going with this is, Neil and I have this show about mental illnesses, and as I'm listening to you talk about eating and food, I'm wondering what's the connection. So help me out here. Connect the two. Eating disorders have any connection whatsoever with mental illnesses, or is this all just about food?
Okay. Eating disorders are not about food. The misuse of food in eating disorders is really a symptom of some other underlying issues. Often, it's a symptom of low self-esteem, not feeling very in control of one's life, wanting to please and gain approval. So the eating or the not eating is really a way of sending a message, which is that something inside me is not okay. Something is not right. Now, you also asked about kind of comorbidity with other mental illnesses. And what we do see, actually, is with anorexia, we see a comorbidity with obsessive-compulsive disorder. So some people who move into anorexia, anorexic behavior, also have symptoms of obsessive-compulsive disorder. With bulimia, what we often see is depression, co-occurrence with depression, and we see a co-occurrence with other impulse control disorders, like the ADHD that Neil mentioned. We do see an overlap there.
Okay.
Now, Robin, we hear a lot about the relationship between eating disorders and child abuse, sexual abuse. Why is it that we hear that? If you have an eating disorder, does that mean that you were sexually abused and you just don't remember it or you're not talking about it? Tell me more about that whole issue or controversy.
Well, I don't know that it's controversial. The research has shown that, again, that there's a co-occurrence between women who experience sexual abuse as child, teen, young adult, and eating disorders, and the co-occurrence is about 65%. So about 65% of the people who present with an eating disorder have somewhere in their history a sexually abusive experience. That's what the research tells you. My clinical experience does not show it to be as high as that. I would say my clinical experience shows about a 25% co-occurrence. But again, I'm not a random sample. My population may be different than what's being studied in the research.
But basically, it doesn't mean that you've been abused simply because you have an eating disorder. As you say, they travel down the road together in a substantial minority of patients. Or maybe a slight majority of patients in some of the research, but they don't have to go together.
No, but why they do go together relates to this issue of control. That when someone is abused, someone is sexually abused, one of the main issues becomes loss of control, loss of power, feelings of helplessness, feelings of being powered over. And the one thing that we really can control is what we put into our bodies in terms of food. So women who have been sexually abused are searching for some grounding, some way to have some sense of control, and it makes sense that they would maybe turn to an eating disorder.
Sure, and I understand that, and I think I've seen plenty of patients with that kind of dynamic. Now, I want to just flip things a little bit here. We know that there is a growing problem with obesity in the United States, and we hear, especially in teenagers, that they're playing on their Xbox, they don't exercise, and America is becoming a nation of obesity. And how do we as parents deal with the message of, well, we don't want you to be obese, but we don't want you to be anorexic, and how do you walk that tightrope here?
I think it's an incredible challenge as a parent, how to do that. And again, what I would go back to say is that as parents, we have to model healthy eating behavior and healthy exercise behaviors for our children. So it's not just the 16-year-old sitting on the couch playing the Xbox who's obese. It's his or her parents who are also doing the same thing. So the best way that we can teach our children is through an example.
What if you have parents mandating that kids have dinner with the family some minimum number of nights per week?
I think family dinners are the things we absolutely all need to be having as many nights a week as we can. And research is showing that whether we're looking at eating disorders, whether we're looking at teen suicide, whether we're looking at teen depression, that regular family dinners are the best thing in terms of helping your children succeed, helping them with their mental health, helping them with issues, helping them become responsible adults.
But so they whine about it, you have to tell them they have to be home for dinner anyway.
That's right. That's right. We become, parents think they're afraid to set limits on their kids.
I think all three of us are going to agree that parents need to set limits on kids. There's going to be no disagreement in this room on that statement tonight, and I know that.
All right, but before we get to the treatment of setting limits, which seems to be probably just the easiest part of what is becoming, the more you talk, Robin, it's becoming a more complicated problem here. Given the breadth of symptoms that you've described and the variety of disorders, can you envision and then communicate with us and our audience what or how a typical patient would show up or present in your office?
Okay. There is no typical patient. Is really what we're trying to talk about here. And so patients come to me from a whole variety of sources. I do get a fair number of people who are self-referred, who have been struggling with this, maybe since high school. They're now out of college. Maybe they're getting engaged. Maybe they want to get pregnant, and so they call and they say, I've been struggling with this for 10 years. I don't want to do it anymore. So I do get people who are self-referred. I get a fair number of referrals from pediatricians, because pediatricians are often, when a family is concerned about their child, the pediatrician is who they take the child to. So a pediatrician will make a referral. I get referrals from a lot of other mental health professionals, because while eating disorders are very prevalent, a lot of mental health professionals aren't trained and or don't want to work with this population. It's not an easy population to work with. So I'll get referrals from other mental health professionals. I get referrals from OBG doctors and wellness centers at high schools. It really comes from lots of different sources.
And
parents.
Do your patients generally cover the whole variety and depth of severity of symptoms when they present in your office?
Yes. I will get someone who is at total medical risk showing up in my office, who we need to immediately hospitalize. And I'll also get a teenager who, for the last 2 months, has been restricting her eating and has maybe lost 5 or 7 pounds, is concerned about it, parents are concerned about it. So yeah, I get the whole spectrum in my office.
You mentioned OBGYN, which just makes me remember one other thing parents might want to look for, and that's changes in menstrual cycles in their adolescent girls.
Right.
That when you lose enough body weight and you stress some of the biological changes that can happen in the brain, but we get them elsewhere in the body, and that if a girl loses enough weight, she may stop menstruating or have changes in her menstrual cycle, and that's something that a mom might notice.
Might be able to pick up on.
And might pick up on, and that's worth keeping in mind. We're going to be going to break. Coming back after break, we will continue and talk about treatment of the eating disorders. We're on Psychiatry Ask the Expert with Dr. Kaye, Jay, and Dr. Sesan. Callers, give us a call tonight, 866-472-5792. Back after break.
Helping you make informed decisions for your life. This is Voice America Health and Wellness.
Hey, how you doing? Educational videos, top quality, right here.
You'll never hear anyone selling education on the street. But with free family learning programs, you can get the education you need. Call 1-877-FAMLIT1 for information on free learning programs. 1-877-FAMLIT1.
Check it out. You want your GED right here, guaranteed, ma. Come on, check it out.
Free family learning programs from the National Center for Family Literacy. Brought to you by the National Center for Family Literacy and the Ad Council.
When you combine energy secrets from ancient China and the latest breakthroughs in medicinal science, you get power healing with Dr. Shah. heard every Friday at 5 p.m. Pacific Time on Voice America Health and Wellness. Each week, Dr. Shaw will bring you another step closer to the expanding world of body-space medicine. You will quickly learn and appreciate how power healing is a perfect alternative to hospitals and expensive drugs. Take a step beyond modern medicine every Friday at 5 p.m. Pacific Time with Dr. Shaw on Power Healing, right here on Voice America Health and Wellness.
Growing Up in America explores the challenges, risks, benefits, and differences this generation of children face each day. Hosted by veteran pediatric emergency physician and father of 4, Dr. Charles Muzica, this show is for parents, teens, and children. It crosses each generation. By exploring the unique aspects of matriculation within this current generation, we hope to find answers and ways of optimizing this experience for today's generation. Growing Up in America with Dr. Charles Muzica broadcasts each Tuesday at 2 p.m. Pacific, 5 p.m. Eastern on the Voice America Health and Wellness channel.
Opinions, options, answers. Voice America Health and Wellness.
Welcome back to Psychiatry Ask the Expert. If you have a question or comment, dial toll-free at 1-866-369-3742. Now back to the show. Here's Dr. Kaye.
Hi, welcome back to Psychiatry Ask the Expert. This is not Dr. Kaye, this is Jay Birch, and we are here this evening with Dr. Robin Sesan discussing eating disorders. I believe we have Donna on the line. Do you have a question for us this evening, Donna?
Yes, I do. You mentioned earlier about patients at risk, and I think you were talking about medical risks, and I kind of wanted to know what are some of the medical problems or consequences of these eating disorders.
Did you hear that?
Take it? Yeah. Okay. That's a great question, Donna. I'm really glad that you're asking kind of a follow-up to that. It really depends on what eating disorder we're talking about. With anorexia, probably the main risk is that the low weight puts someone into medical risk in terms of their heart functioning, in terms of their electrolyte balances, and really just in terms of many of their systems starting to shut down. Now, I don't know, Neil, if you want to say more about medical risks.
Yeah, there's a lot of medical risks that can come into this. One of the long-term ones that we worry about is bone density.
Osteoporosis.
So osteoporosis is much more common in women who have had eating disorders and been restricting themselves. That's one. Obviously, changes in hormone balance can be a problem as well. So those are probably the ones that we tend to think about the most commonly. Robin noted earlier that in anorexia, the electrolyte imbalances can be pretty severe. In fact, about 1 out of every 6 to 8 patients with significant anorexia will actually die from the disorder.
Mm-hmm.
And I point out that that's about the same as Russian roulette with 1 bullet in the chamber. So it really is a disorder to be taken very, very seriously when people go into the starvation mode too severely. Did we cover your question, Donna?
Yes, thank you.
Great. Thank you for calling in tonight.
Robin, why don't we talk about treatment?
Okay.
You want to outline some basic treatment approaches to eating disorders?
Well, the basic treatment approaches include working often in individual therapy with a psychologist, social worker, licensed counselor, possibly a psychiatrist. We often involve, when it's a teenager at home or a child, family counseling as well, so take a look at some of the family systems issues. Group therapy can be very, very helpful, but we have to be careful with group therapy because one of the things that happens is bulimics learn from anorexics, anorexics learn bad behavior from bulimics, and there's a lot of competition that can develop in the group. So my preference actually is to put women with eating disorders into what I would call a heterogeneous group. So they're in there with women who might just have depression and not an eating disorder, or women who struggle with relationship issues. And that way, healthier things are modeled for the woman with eating disorders.
That seems much more consistent with your view that the eating is actually more a symptom of underlying problems and that the disorder is not the food itself.
Right.
So by mixing it together, I think that you're approaching it in a consistent manner. That makes a lot of sense to me.
Earlier you talked about sometimes you get self-referral patients, sometimes you get patients referred to you from other sources, pediatricians, other mental health professionals. If I am in need of an eating disorder specialist, are you a specialist in eating disorders, or how would I find somebody with your expertise?
I am a specialist in the treatment of eating disorders, but at this point, there's really no official body that certifies or credentials people as eating disorder specialists. So if someone's searching for a therapist, they really need to ask some questions in terms of how long the therapist has been doing this work, how experienced they are, what types of eating disorders they've worked with, what their success rate is with patients. Because, I spoke with a woman today who's been through about 15 different therapists to help her treat her eating disorder. And the things she was telling me that the therapist would say, I don't really understand why, if you're going to binge, you don't just binge on chocolate because it tastes better. The therapist really had no idea or experience. And so I think it's very, very important that people do their research. They can look on certain websites to find practitioners who are listed on those websites. There's an academy for eating disorders that people can check with. So I think it's very important that you find someone skilled and experienced.
And I want to second that. I think one of the things where Robin and I are probably going to agree is that a lot of times these patients need more than one therapeutic approach.
Yes.
Individual therapy, maybe group therapy, and actually medication sometimes come into this as well. And you and I have shared a number of patients, that's for sure. You talked about the relationship between OCD, obsessive-compulsive disorder, and anorexia, and of bulimia and depression. And a lot of comorbidity, meaning a patient has more than one of these at the same time. And that leads us into some of the treatments. What are the keys that make you think, gee, this patient needs to see a psychiatrist, somebody can get medication in addition to the talking therapies that you're doing?
Well, when I am working with someone, I really try and assess which disorder is primary. So if, in fact, I'm working with someone with bulimia, but the depression is what's making it very difficult to achieve motivation, to comply with some of my treatment recommendations, I'm going to assume then that the depression is primary, and until we treat the depression, we're not going to really be able to address the eating disorder.
Okay. And for me, when I get that patient from you or a colleague, I'm looking at, again, same question you are. How much is depression? How much is anxiety? What medications are going to be best in this area? I try to be mindful of the side effect profile of medications.
Right.
People with eating disorders frequently are more prone to side effects, as are people with anxiety. I know some of my colleagues think, well, I'll use medicines that make people get fat as a side effect, and they think that they're going to fool these patients by choosing certain medications. And what I like to say when I talk about this to my medical colleagues is that doesn't work. These girls are way too smart. They've been around, and they know which are the get-fat meds, and they won't take them. So we actually try to use medications that are weight neutral. Serotonin reuptake inhibitors are fairly common in this area because of their ability to help with both mood and anxiety together. They're certainly one of the groups that we use. Also, drugs to reduce anxiety can have a place in this population. We also need to be careful about when they take their medications, because if they're going to purge or use laxatives, we may not actually ever get the drug absorbed because it's just not in their system long enough, and that certainly comes into my area sometimes. Any thoughts you have or recommendations, again, for the patients, the parents, in terms of combining talking and non-talking strategies and how to be supportive about that?
Well, the one thing that I have neglected to mention is the role of a nutritionist. Because when we work with eating disorders, we really like to think of a team. And the team would be composed of a psychologist, a psychiatrist, a medical doctor, and a nutritionist. Because for me as a therapist, I don't want to get bogged down in the details of what someone's eating or what someone's not eating. I'm not trained to do that. So I think bringing in a nutritionist takes me out of that role and allows the patient to develop another supportive relationship with someone who will work more on helping them get back on track in their eating.
Absolutely great idea, and I certainly endorse that. What about weighing patients? How often should patients weigh themselves, or should other people weigh them, or ask about their weight? What's the recommendation these days?
Well, I think the answer to that would be really varied depending on who is sitting here. So I'll tell you my opinion about that.
Okay. You're the expert, so that's the opinion we want.
I am opposed to weighing my patients. I feel like that gets me into a big struggle with them. But when I'm working with a very low-weight anorexic patient, I want someone monitoring their weight, and that can be the nutritionist and it can be the physician. Often they need to be weighed on a weekly basis. And in part, it's to calm them down, because as you're starting to work with an anorexic, refeeding and gaining weight, they're panicking that they're going to gain 5 pounds a week, and they really need some reassurance that they might gain a quarter of a pound or a half a pound a week, and that can be manageable.
And wouldn't somebody like this be more than likely be weighing themselves more often than once a week?
They would more likely be weighing themselves, but I work with them to get them away from the scale, because the number on the scale is not their identity.
And that's a good point. You are not your weight. We're coming into the end of the show. I want to thank our listeners and thank you, Robin, for being our guest tonight. A couple wrap-up points. Eating disorders are serious. They can be life-threatening. They need to be properly evaluated and treated. Starting with psychotherapy, very appropriate. Referral for medications might be made by a therapist, and we are going to endorse the team approach, medical doctor, nutritionist, psychotherapist, and maybe a psychiatrist. And please, be good to your body. You only get one of these. If you or someone you know might be experiencing a mental illness, an emotional problem, an eating disorder, please help them find professional help while you continue to be the support that only family or friends can provide. Talk to your doctor or friends who have worked with you in the past and develop a trusting relationship. Contact local medical societies or professional organizations for good referrals. In the world of eating disorders, a couple of websites we recommend tonight, the National Eating Disorders.org, womensmentalhealth.org, edreferrals.com, healthyminds.org, NAMI.org, and NIMH.org. For psychiatry, ask the expert, Dr. Kaye.
Jay Birch.
We want to both thank you, Dr. Robin Sesan, for being our guest
tonight.
Robin.
I was happy to be here.
And next week we have open line call-in, and we're going to do sort of a potpourri of mental health issues.
Target practice.
Ask the expert. We'll see everybody next week.
Thank you for listening to Psychiatry Ask the Expert. To learn more about Dr. Kaye, visit courtpsychiatrist.com. Tune in next Tuesday for another hour of Psychiatry Ask the Expert with Dr. Neil Kaye.